Would you like to lose weight, improve your health, and reduce the amount of prescription medications you're taking? Mike did. He lost 75 pounds, is no longer diabetic, and is down from 8 prescription meds to 2. Miriam did. She lost 41 pounds, is no longer diabetic, and lost 7 inches from her waist. 8 Weeks to Wellness incorporates a complete health assessment, blood work, and body composition to create a personalized diet, wellness, and fitness program just for you. Call today for a free doctor consultation. Give us 8 weeks, and we'll change the rest of your life.
Hey there, I'm Dr. Dane Donahue, and I'm co-founder of a program called 8 Weeks to Wellness. And 8 Weeks to Wellness is something that we created back in 2003 in response to a need that I saw growing in America, and that is America is becoming sicker and sicker. We're becoming more and more dependent on prescription medications to take care of things that we really should be taking care of naturally. Chronic diseases such as heart disease, cancer, diabetes are running rampant in this country and claiming way too many lives.
One day he's diabetic, taking 8 prescription meds. He lost 75 pounds and he is no longer diabetic. Mike credits a program called 8 Weeks to Wellness for his new and improved health.
Yeah, and Dr. Rick Ruby is here from Ruby Chiropractic Wellness to tell you more about this comprehensive program. Thanks for being here, Doctor.
Thank you for having me.
Nice to have you.
I think that's a really inspiring story about Mike, who was able to get off diabetic medicine. I think a lot of people can resonate with that kind of diagnosis and knowing that they need to change their lifestyle with type 2 diabetes. Tell us a little bit about him and why he came to you to do the program.
Well, obviously, again, health was really important to him. You saw that when he woke up every morning, he wasn't happy with himself, didn't like how he felt. But again, like most of us in the U.S., he didn't really like, what he looked like.
Yeah.
And that's the big trigger point. And by coming into the program, we actually get to work with them with how they think, how they eat and supplement, and then also, how they exercise to care for the body for the rest of their life.
Mm-hmm. As we look at this diagram of metabolic syndrome, what is it and what role does it have in problems that we have with trying to lose weight?
Well, and that's a great question. Most people don't even know they have metabolic syndrome, and 40% of us over the age of 40, we have it. And and if you do have it, you're at a significant increased risk for diabetes and cardiovascular disease. So if you have 3 or more of the following parameters, that's going to obviously make you at risk for the condition.
So there are things like your waist circumference, if it's over a certain number of inches for men and women, which is different. If your triglycerides are high, over 100, right?
Yep.
And then you're also looking at the bad cholesterol, the HDL, blood pressure, as well as blood glucose, which is sugar, sugar in the blood, right?
Right. And HDL is actually good cholesterol.
Oh, good cholesterol.
And that's okay. But then, yeah, absolutely. And the thing is again, we actually have a plan to defeat this.
Miriam, she lost over 40 pounds, right?
Correct. Yep. And 7.5 inches off her waist.
Wow.
Yeah, and again, her cholesterol levels also decreased by 20 points as well.
What's the secret to this 8 weeks to wellness? Is it pills? Is it exercise? Is it diet? Is it supplements?
Okay, absolutely no pills. Okay, this is all natural and it's all based on hard work and effort. But the unique factor of what we have in our office is how we help you hold you accountable. All right, and again, we have a plan. It's all scripted out for you with a manual, and again, it's also really convenient because it's under one roof.
Decrease in cholesterol by 20 points, 6.5 inches off the waist and hips.
Yeah,
decrease the symptomatic complaints by at least half. Decrease blood pressure by 10 points. These are the average results, right?
Average results.
Incredible. And improving letter grades on the wellness score, too.
Welcome back. Now, people all over the Denver metro area are shedding inches, getting stronger, and gaining a lot of energy, really changing their lives in just 8 weeks. I want to see her before and afters because, that really speaks volumes. Let's take a look. Wow, look at all the definition.
Yeah.
To talk us through this.
Yeah, so to see the abdominal area, the less fat in there, what happens when you have less abdominal fat, it sets you up for metabolic syndrome if people have a lot of weight in the abdominal area. So decreased chances of cancer, decreased chances of diabetes, heart disease, postural changes
Look at the
happen.
difference in the posture on the profile here.
Yeah, and look at her arms. Look at the muscle definition in her arms. She didn't have a lot of weight to lose anyways, but we talked about biomarkers of aging. The number one biomarker of aging is decreased body fat and increased lean body mass, which is muscle. And that's what Rhonda got through this program. So people from all walks of life can achieve better success in this program depending on their goals.
Yeah.
Rhonda and I, we regularly went to the gym to work out, but it really wasn't the priority that it was until we joined the 8 Weeks to Wellness program. And so with that, we made it a priority. The diet was extremely important, the exercise was extremely important, and we achieved results that we never really expected.
Yeah, we're already seeing them. Look at your before and afters. This is just the front shot. I can see, just how much bigger your pecs are. Look at the difference in the profile. Much slimmer.
Yeah,
yeah.
It's amazing that look at the definition of his arms.
Yes.
Look at his in the neck and the jawline there, and look at his postural changes in there.
How much weight are we talking here?
So David lost about 15 pounds on the program. Now to date, he's lost about 25 pounds. And that's the big thing. People don't realize in 8 weeks, it's a major change. Insulin markers down, HbA1c, which is long-term indicator of diabetes. All those factors, every one of their factors came down, except for the good factors. HDL went up, vitamin D levels went up. So to see the enormous
Negative things
changes,
go down, good things go up.
Excellent.
And we've talked about how it's really the focus is not losing weight, it's feeling great.
Well, we're talking wellness now. It's easy to know when we are sick, but how do we know we are really healthy. Here to explain is Dr. Dane Donahue of 8 Weeks to Wellness. Good to see you, sir.
Good to see you.
Indeed, indeed. Now, we know when we're feeling good, and we don't feel good, rather. We have symptoms, and we know we're sick. But how do we know when we're healthy?
This is a great question, and Isaac Newton taught us a real good principle a long time ago, and that is for every action, there's an equal and opposite reaction.
Right? Mm-hmm.
Right? So that's the law of cause and effect. And in our society today, we focus on effects. Those are symptoms, those are diagnostic tests. So we know when we're sick or we know when we have a diagnosis. And remember, most people are dying of heart disease, cancer, diabetes. All these are kind of silent killers.
Mm-hmm.
So how good is it to know when we're well? And in our office, we use something called a wellness score, where we're not necessarily focusing on symptoms and sickness. We're going to focus on how healthy is a person, how resilient is that person, so they never get a disease in the first place.
Break down that focus. Tell us more about this wellness score.
Okay, so wellness score looks at physiology. And again, in our practice, we always say to our patients, physiology doesn't lie. So your blood pressure is your blood pressure, your BMI, your body mass index. Looking at things like functional fitness, how a person is moving. Looking at things like their nervous system and how is their nervous system adapting to stress, because we all have stress. So we put these all together in a puzzle, and it gives us an overall grade or a wellness score for our patients to know how resilient is that person. Are they doing a great job at preventing things like heart disease? Because think about it, Yuki, nobody wakes up and says, today I want to have a heart attack. But a lot of people wake up with heart disease. No woman wakes up and says, today I want to be diagnosed with breast cancer. But most cancer is in the body for years before it becomes diagnosable. So to have a test to know exactly how resilient is the body, how healthy is the body, is so important.
Which leads us into biomarkers.
Exactly.
Talk about that.
So biomarkers we use a bunch of different biomarkers in our office, but some of the important ones like blood work. One of the things we use is something called triglyceride to HDL ratio, and everybody should know this ratio. Everybody knows their cholesterol, but triglyceride to HDL ratio is 17 times more predictive of a heart attack or a stroke. So that's one of the biomarkers. We look at body mass index. We look at waist to hip ratio, which tells us how much belly fat a person's carrying, which is a cause of chronic disease. So we take all of this stuff, we put it together in an overall wellness score, give this person a wellness grade. And it's surprising. A lot of people are asymptomatic or getting F's and D's on their wellness score, which means they're headed towards chronic disease.
I always heard, we have just about out of time, that if you have a certain belt size, depending on what that number is, you need to get checked out.
Without a doubt, and that's what the wellness score will tell you.
You're the man. Thank you, sir.
You're welcome.
There you go.